Hey guys, this is Jeremy, and today we're going to be talking about scope of practice and training of the different provider levels. So what we're going to start off with first is going to be the EMD, or Emergency Medical Dispatcher. Now, there are some places where an emergency medical dispatcher may actually go through an approved course and may consist of on-the-job training. There's lots of different ways that you can go about getting into being a dispatcher. But the big thing about what a dispatcher does is they ensure that fire, police, and EMS we're all able to get to the location of where the actual event is. So they may be on the call, or they're going to be on the phone with somebody while their crisis is actually happening and trying to get us to them. So they're trying to get accurate information, which can be kind of stressful whenever you are you are talking with somebody who is in a panic situation themselves. So they have to be trained to kind of how to verbally coach somebody through how to get them that information. And so this can come across a lot of people as, the dispatchers being cold or heartless on the phone, but they're really trying to have a calm, controlled demeanor to get as much information as possible to help them. So us as providers can actually make it to them. They're gonna be the ones that before we get there, those are gonna be the ones that are giving those pre-arrival instructions, staying on the phone with somebody as they give CPR to their mother, their husband, their child. They're going to ensure that we have the adequate information that we need to help them help themselves. Now, next is going to be the emergency medical responder. So EMRs, which that actually used to be called the first responders. Those are typically only going to be trained in CPR and general first aid. Now, that doesn't mean that that's all they're going to know how to do, but because there's additional training that goes with it. They can go with it, and they can always get that in the field. But emergency medical responders, or these first responders, that's going to be what make up a lot of your fire departments, or a lot of the police officers. They're going to be first responders. They're going to be trained in CPR. They're going to be trained in first aid. And they may not have that advanced level medical knowledge or training. So they're absolutely essential to patient care. And that's going to be especially true in rural areas where you may not have readily available access to paramedics or EMTs, or you may have an hour to the closest hospital. There are cases where that may be the case, and that emergency medical responder, that's going to be the person that's going to be first on scene. It's going to be with that patient the longest. And as long as they're coached correctly, and they actually have the appropriate knowledge and the right drive, emergency medical responders, they can be absolutely essential to the team and help you get that information and help you actually take care of your patients. So build up a good relationship with the first responders, because those are likely, again, going to be the people that get first on scene. You want to make sure that the people you work with, they trust you, they know you, and they know that whenever you show up on scene, it's going to go as well as it possibly could go. And emergency medical responders, that's actually how a lot of EMTs and first responders, or I'm sorry, EMTs and paramedics, they start out as first responders. Reason being because that's their entry into this field, and that could be as a firefighter. So they're getting those double levels of training. So they're working on the fire side, and they're trying to get their medical side as well. So just kind of be aware of that. Now next you have EMTs, or EMT basic. That's going to be whenever we're getting into like the national certification, state approved courses. And this is the minimum level of certification that's going to be required of somebody to be eligible to enter a paramedic program anywhere. If you have somebody that's going straight into a paramedic program, the EMT curriculum is going to be built in with that knowledge, and they're going to be able to obtain that EMT certification before they actually move on to the paramedic portion of that program. Now, the skills that an EMT can do, they vary from state to state. So what they do here in Georgia may not necessarily be the same thing that's being done in Kansas, but that's going to depend on the medical director of that service. So National Registry, what they've done is they've just established a standard of training that's expected of all EMTs to have. and that's what a lot of programs teach by. And then whenever you obtain that initial certification from National Registry, that's going to allow you to be licensed at the state level, where your place of employment, your medical director, they may train you on additional things as an EMT. They may allow your EMTs to give Tylenol, or to give or to start IVs, or start more invasive airway procedures aside from the OPAs and NPAs. Now, the EMTs, those are going to be the most abundant number of providers. There's more EMTs than there are AMTs. There's more EMTs than there are paramedics. And it's an abundant number, and it's an entry level position for the most part. Now, you have people that may be EMTs for their entire career, and that's okay. But that's at that basic level of knowledge, that basic level of understanding of these skills, as far as what they're trained and certified to. Now, an EMT, they can go on and get ACLS and PALS and all these other advanced certifications, but at the national level and even at the state, an EMT is only recognized as an EMT in what they can do under that scope of practice. Now, you're expected as an EMT. OPAs and NPAs, those are going to be within your scope of practice. You can do backboarding, CPR, and AED, just like a first responder. And you're expected to have a basic understanding of anatomy and pathophysiology as an EMT. That you're not held to that standard as a first responder or an EMR, or even as a dispatcher. But you're expected to be able to have some kind of intelligent conversations with somebody about what it is that they have going on, and be able to talk to the people in the hospital about what types of patient it is that you're bringing them. Now, advanced EMTs, that's going to be the most recent certification level that's been brought forward on the national level. There used to be EMTIs or intermediates, and so now they moved to the AEMT, the advanced EMT. And so all the EMTIs at the national level, they're having to transition to the advanced EMT level, or attend a paramedic program to get their paramedic certification, or they're actually going to be reverted back down to EMT basics on the national level. And so, but the advanced EMTs, they have the ability to start IVs. At the national level, they have ability to give medications, IV, such as Narcan and D50, and they can give Epi for anaphylaxis. That they draw up themselves. It's not just through a multi-dose, or not a multi-dose, but a EpiPen auto injector. So, and that's all really important. Now, advanced EMTs, they can also do Supraglottic Airways, which is a lot different than an OPA and an NPA. Because you're actually bringing the opening of whatever airway device it is that you're using, instead of taking it to the mouth and the nose, you're actually bringing it just above the glottis, and you almost have direct access to the trachea. Now, if somebody has an airway obstruction or they have a laryngospasm, it's not going to work, but it's getting us in the right direction, and they're able to start that as quick as possible. And they're advanced EMTs, they're also expected to have a basic understanding of the cardiac monitor, at least how to set it up, obtain 12 leads, 12 lead placement. And while they're not expected to understand what the rhythm is actually, what's actually happening with the rhythms on the monitor, that's something that you need to be aware of. It's like, hey, that looks a little weird. Maybe I need to do something. Maybe I need to call somebody. And that's the big thing with the advanced EMTs. Now, paramedics. Paramedics, that's going to be the highest level that at certified or recognized at a national level. Now, you can always go on and get your critical care paramedic, flight paramedic at the state level, or get those certifications. But they're expected to have a greater understanding of pathophysiology, the anatomy, and you're held to a higher standard because really we're the greatest level of care that anybody's going to be able to receive in the field, and that's what they're expecting whenever you show up. Paramedics, they average between 1,000 and 1,500 classroom hours, all lecture hours. That includes the classroom, the lab, and even the clinical setting in the field. So that's a lot of knowledge that you can obtain in that amount of time. Now, as a paramedic, you do you are expected to have that advanced level of understanding of the cardiac monitor. You're expected to be able to interpret the rhythms accurately. You're expected to be able to interpret 12 leads accurately and initiate the care of what those rhythms and what those indications may show on the 12 lead. Initiate that care. If you have a heart block, what do you do? If you have somebody who's in VTAC or VFib, as a paramedic, you're expected to recognize that, and not necessarily just something that the AED is going to tell you. As a paramedic, you have the ability to perform advanced or definitive airway management, and that's going to be in the form of a intubation, where you actually take a tube straight into the trachea, which gives you direct access to the lungs. Now, you can do minor surgical procedures such as a cricothyrotomy, where you actually take a scalpel or a needle to the cricothyroid membrane in the neck, and you're controlling somebody's airway that way. Some places, you can do chest tubes. But you're expected to know how to perform needle decompression for somebody who's got a pneumothorax. And there's just a lot of additional knowledge that comes with those skills, because you're going to have an advanced understanding of that pathophysiology, and that's really important. Now, you are also going to be expected to know about ventilators as a paramedic, and at least at the basic level. Understanding that air moves in, air moves out. What's actually happening? Or can you interpret end-tidal? The answer should be yes as a paramedic, because end-tidal capnography, that's the gold standard when it comes to airway management. And so, with the paramedic being the highest level of care that can be in the field, there's a lot of risk and a lot of responsibility associated with it. You have people that look up to you on scene, especially when it comes time to make the hard decisions about what to do with a patient. Now, so those are going to be the real big differences, and we cannot function without one another. A paramedic, they need the dispatchers to actually make it to the call. So don't think that just because you are a paramedic, or you got your paramedic, or you're getting a paramedic, that you're the end all be all, because we all rely on one another, and that's the way it should be, and that's what makes us a system, is because we all work together, and we have an understanding of what everybody's job actually is, and the roles that we can all play. And so, guys, that's going to be the big difference, and that's the scope of practice and the training.